Welcome to the What I Wish I Knew After Pregnancy Loss podcast. I am your host, Shana Southern. I am an angel mum, a rainbow mum, a pregnancy loss practitioner, and trauma-informed coach. I created the Institute of Healing Through Pregnancy Loss out of my own experience with loss in the hopes to provide understanding and healing, educating people on pregnancy loss, and creating more women or men in trained support roles. In this podcast, I hope to shed light on what I wish I knew in relation to pregnancy loss, opening up the conversation, breaking the stigma, and bringing real-life stories plus guest experts. Thank you for being here with me today, and let's dive into today's episode. Before we dive into today's episode, I need to pause for a moment because this is actually our 100th episode together. And I cannot let that milestone pass without acknowledging something profound. When I first started this podcast, I had no idea it would become what it is today. I simply knew there was a conversation that needed to happen about pregnancy loss, about trauma, about the gaps in support that so many of us were experiencing. But you, the incredible humans listening to this, you've made this so much more than I ever imagined. Over these 100 episodes, you've downloaded, you've shared, you've sent voice messages, you've tagged friends who needed to hear these conversations. You've kept this movement alive and growing. You've created a ripple effect that's reached practitioners around the world, lost parents who finally felt seen, and healthcare providers who are transforming how they show up for families. You've proven that these conversations matter, that this work matters. Every time you hit play, every time you share an episode, every time you tell someone you need to listen to this, you're changing how we understand and support reproductive trauma and loss. So from the bottom of my heart, thank you. Thank you for being part of this revolution. Thank you for believing that we can do better. Thank you for keeping these essential conversations going. Here's to the next 100 episodes and the continued transformation of how we hold space for pregnancy loss. Now let's dive into today's episode. Welcome to the podcast, the intersection of pregnancy loss, fertility, trauma, and purpose, having the conversations that should have been happening all along. Today, I have with me Nicole. Sorry, I didn't check how to say your surname.
Nicole
Lange. There we go. That
Easy.
E threw me. Nicole Lange.
It works.
Nicole founded Life Healing Life in Minneapolis with a revolutionary approach to healthcare that transcends the traditional doctor fixes patient model. As an acupuncturist and practitioner of traditional Chinese medicine, she embraces a unique perspective that integrates Eastern practices with Western medicine and scientific innovation. Professional journey originally on track to become a geneticist. Yeah. Nicole's life took an unexpected turn that led her to earn her master's degree in Chinese medicine. More than 20 years later, she has established herself as an acupuncturist, holistic educator, and pioneer in women's reproductive healthcare. Nicole's practice philosophy emerged during her student internship in 2004 when she chose depth over volume, seeing fewer patients to provide more comprehensive care and education. This approach has evolved into a distinctive methodology and weaves together traditional holistic medicine, cutting-edge science, and profound philosophical inquiry about true fertility and wellness. Her extensive experience includes supporting nearly 1,000 embryo transfers, witnessing births, holding space for grief, and celebrating life's most significant achievements. Nicole practices medicine with exceptional care, depth, and intention, consistently delivering transformative outcomes. Thank you for joining us, Nicole.
Such a joy. I'm so glad to be here.
You're so welcome. I swear you're in my brain with what you want to talk about today.
I love it. Synergy.
Yes, absolutely. So, do you want to share your story and what has led you to create what you have created?
Yeah. So I did not know Chinese medicine. I didn't grow up in a crunchy granola, holistic, natural kind of environment at all. And I loved Western medicine. My favorite book when I was a little kid was How Louis Pasteur Invented a Vaccine for Rabies. I would pretend I was a botanist with plants, and I would do library sciences and check out books to imaginary people. And I pretended I was an orthodontist and would put braces on my dolls with salt from the pretzel bag. And I was really into Western medicine. So I intended to be a geneticist. And then there was a massive upheaval in my life in the form of an assault and a subsequent suicide attempt and ICU stay and hospitalization and psychiatric hospital. And a lot of people say, I'm so sorry, but I'm this far out. I can say that how I feel about it is I can't separate it from who I am and my life. And I love who I am and I love my life. So I can say at this point, I'm really grateful for it. But when I went as far as Western medicine could take, which you bet I did, then I hit this wall where there were all these seemingly separate things that were less than ideal. And I wanted to feel better than what I was. And so, in this place of skeptical desperation, probably, I looked into Chinese medicine, and I'm not the kind of person to do something halfway. So, I've got my master's degree in it. And I really had never had a real acupuncture treatment in my life. I'd gotten a couple of needle sessions from a chiropractor, and then I got my master's degree. And as I was going through school, I was blown away at how much more than placebo it was and how amazing it was and how, the depth and the connections it made. But then I was seeing how we really weren't taught to teach the ideas to our patients. We were just, you stick the needles in, you do the differential diagnosis, which is really cool and connects all the things. But then you know that in your brain, they come in, you put the needles in for that differential diagnosis, you give them the herbs, you tell them which foods to eat that go with that pattern, and then send them on their way. And so I thought, no, that's the most interesting, most beneficial for my own journey. Part of this was the ideas and understanding the body and the mind in different ways. And so I started making new analogies and new methods to teach to make it really user friendly to more mainstream Western minded folks. So that's where I got to a lot of my analogies. I think of the body as a bank account. That's a big one that I use. And I also think of the reproductive parts because I really do specialize in fertility and trauma. I think of reproductive bits and pieces like the nursery, and the rest of the house is the mind and body. And then the rest of the neighborhood is the relationships and the life and the purpose and the career. And then there's even something deeper, the foundation, which is the purpose and the reframes and the where the trauma lives in the nervous system and things like we're going to talk about today. So we're going deep to the foundation, but we're addressing all these layers.
Yeah, thank you so much. Like I said, you're in my brain because I totally love everything. And when, as we spoke about before we got on, there is such an interconnectedness, like with everyone, regardless of what their experience has been. And this is not something that you will find in your doctor's office. So I love that you have been able to obviously take your experience, do the training, and then go, okay, I really need to make this again more user friendly. And I love that we get to dive deep with that today. So we you mentioned your methodology is the nursery house neighborhood. And it's funny that you said that in the way that you have, because when I teach about trauma, I teach about it in the sense of the house, like coming home.
Mm.
So, yeah, it's really bizarre. And I'm hoping that I feel like I'm understanding what, like, your analogy. the right way.
because your brain's already locked into yours. Yeah, there's different ways to think about it. But yeah, so in my analogy, the house might be, we were talking about digestion before we got on the call, and that would be like the kitchen. And there's the attic with the mental health, and there's the air conditioner and the furnace, and how warm and how cold you are, and all these different, the sleep is the bedroom. So all these parts that you might see 50 different doctors for from a reductionistic perspective, that's all coming together into the house. And of course, the nursery matters. We really want to move a baby in and have a baby stay in our nursery when we're working on fertility and pregnancy loss. But I think the body's really wise. And if the foundation is crumbling and there's a family of raccoons living in the attic and the furnace and the air conditioner on the fritz and the kitchen doesn't have any working appliances, and all of a sudden you're like, but I just spent 18 months doing everything I could to possibly make a baby move into this nursery, make the nursery as nice as possible, and analyze every single nook and cranny of the nursery. The body is wiser than that. And it's not to say you can't have a baby move in that condition, but it's not going to be the thriving, abundant mom and healthy pregnancy and baby that we all go into this wanting. And it's only through the sort of horrible heartache and setbacks that we get that beaten out of us to the point where then infertility culture starts taking over. And I would just be happy with a baby. Maybe I need to suffer for this. Maybe I need to not do the things that I'm actually craving and would make me feel better, because I just have to keep trying to have a baby and cut out this and do all these things that make me feel more imbalanced just for the nursery. And it's just causing so much harm and so much unnecessary trauma in a process that has an element of trauma to it already.
Mm.
But then we're compounding it by treating it like this and by approaching it this way.
Yeah, and I do love it. So I'm going to get you to explain the whole nursery house neighborhood, because you've mentioned that the neighborhood is your external relationships in life, the healthy house is your mind and body, and the foundations is the nursery. And as you were describing the house, like you can't work so hard on creating the nursery that you're working in despite of the rest of the house. It
Right.
can't just be the one thing that you're focusing on when your whole body is communicating as a whole.
Exactly.
So you do need to have the house as a functioning house. And this is the awareness that I had too when I was going through healing after my loss was you can't just work on one thing. There are so many different elements of your body that needs support so that you create a holistic health for you, mind, body, spirit, before then you go down the path of trying to conceive and doing all of that. But do you want to, I know you just shared, is there anything else that you wanted to share on your methodology here about the nursery house and neighborhood?
I think that's a good high level of it. I think it's just, and to come back to what a lot of people know, the Western medicine of it, right? It's normal in reductionistic medicine to, you see somebody for sleep if you have sleep issues, you see somebody for anxiety if you have anxiety. And that's how that form of mainstream allopathic medicine has developed. And I mentioned earlier that I like nerding out on some of the history of it. But basically, we used to be very enmeshed in our mind body, was all connected in how we thought about bodies. And then there was a kind of revolution where Rene Descartes separated the mind and the body as a philosopher. And then the mind became the church's kind of property, and the body became science and medicine's property. And they thought, we don't want physicians and scientists messing with the mind, because that's the realm of spirituality. And so we broke them out and we got increasingly reductionistic, which is really helpful in some cases to be able to do that. But we've never really had in modern medicine the whole in mind. And there's a great doctor that I just listened to a podcast that I was on, that he was a prior guest on. His name is Robert C. Smith. He wrote a book called Has Medicine Lost Its Mind? And he was actually teaching about this. And he said, we're at a point where we understand scientifically how enmeshed it is, that it's not just, you literally cannot treat fertility without treating mental health
Mm.
scientifically. And so it's not just bringing it back and making it holistic and touchy feely. It's scientifically sound, evidence based at this point to connect the dots. And you can't make one thing better at the expense of three other things. It won't get you the results you want. And we have all this evidence now that shows that.
Yeah, and I think if I look, and I've looked back over my journey before experiencing my loss, and that's what I was doing. I was
Mm-hmm.
trying to skip over parts. I'm like, no, that's okay. My hormones, they're
Yeah.
irregular. They're not, that's okay. I'll just take a medication and it won't matter. So that was the mindset that I was in. And you want the baby so bad that you skip over all the potential things that you almost know you need to do, but you like,
Yeah.
I just want that end result and
Yeah.
I don't want to do it. And
Yeah, and there's everything in the culture tells you that's the normal way. It's like you see somebody and you're like, "Have you cut out this? Have you done these 50 things? Are you taking these 40 supplements? Have you read this book and listened to this top expert?" And is all of a sudden it's okay, we've got disordered eating, not on purpose, but because it's so limiting and we have no joy and we're obsessive and it's there's so much in the culture that just says that's absolutely what how this is done. And so a
yeah,
big part of my mission is to talk everywhere and yell it from the rooftop that is problematic, that is actually causing harm. And that if that were the only way, I say this all the time, if that were the only way to get pregnant, and it's just like, you have to do this, it has to be done this way, and you're going to have to do a bunch of therapy afterwards, and you're going to have to work on the rest of your body and mind afterwards, that would be one thing. But again, we're to the point where we know this is actual good, scientifically based the future of medicine, and a lot of it is unnecessary. It's this harm caused from the treatment by making it unnecessarily confusing or
mm,
overwhelming or fragmented and not person centered.
yeah, yeah. And I think it's so important to have this awareness that it might, again, we've got to figure out what works for us. There might be someone that tells you, okay, you need to do all this list of things. And it's not to say that none of it, it's not
Right.
important. Just find,
Individually they might all be legit,
yeah,
but together
yeah,
too much.
yeah, exactly. And then you go through, so we went through 5 years of trying to conceive. We ended it in a miscarriage. And I was like, okay, that's it. What the hell? What do I do from here? And that was where I started to become more aware of, okay, I'm not going to go down the traditional medical path at this point. I actually went through acupuncture. The lady that does the acupuncture here, she's a Tibetan monk, an ex-Tibetan monk. So she was like a therapist as well.
That sounds amazing.
So I'd go and she'd literally take my pulse like she did acupuncture. She helped me through the miscarriage as well. And she helped me through obviously trying to get my body back on track. And I spent a lot of time after trying to get my
Mhm.
body back on track. And it can be a very easy trap to fall into when you want to fall pregnant, but you don't want to spend the time. You feel like time is against you, but the time that you spend looking at what can work for you and your body is actually going to be beneficial for you.
And we think about it as a pause or a sidetrack, but it's actually good treatment. If we could reframe it as absolutely, I'm doing fertility treatment by working on my trauma and my nervous system. And that's going to make a cascade for reducing cortisol, which frees up my endocrine system to make more sex hormones and the receptors to be open to bind with them. And for that to influence my ovarian function and my uterine lining. And it's just that we haven't connected the dots. We've been like, no, this is for lining. This is what I'm doing for my lining in a very stressed out way, and now the cortisol is competing for the same building blocks and blocking the receptors and doing it. So it is part of the treatment to step back and to learn and to reframe so that we can do it in a way that works faster and has better outcomes, because the you can force a baby into a bare minimum situation, but of course it's going to set up for more perinatal mood disorders and parenting stress and less vascular placental development and all these things that don't make or break pregnancies. I'm a firm believer that we're not making or breaking viable pregnancies in our life choices, but we are absolutely doing things with epigenetics and the overall health of that kiddo, the overall quality of life for that family, which matter. And we can't lose sight of that.
Yeah, which leads into the next couple of things that I want to talk to you about because obviously trauma affects the reproductive system because essentially our body is such a primitive being when we're in survival response, our bodies know, hell no, you're not actually going to fall pregnant because you're about to be eaten by a tiger. And
Right.
but in our day-to-day society conditioning, stress is like an everyday thing. So our body is in that heightened state more
Mm-hmm.
frequently than what it should be. But it takes, and I think this is where people don't understand, it actually takes away all of the things that you need for your reproductive system. It takes it to where your body believes it would be necessary,
Mm-hmm.
which would be like your heart, your limbs, like whatever it is that feels like you would benefit from at that time. Reproductive, no. Like it takes everything offline because you're like, your body says, no, this is not safe.
Exactly.
And you touched on that just quickly before. And I really want to dive into that because, again, our body remembers. And you sent through like a one-liner. So that says the body remembers what the mind tries to forget. We can mentally, cognitively move on. We can
Yes.
rationalize our way out of it. But your body, you can't fool your
Yeah.
body. You can't trick your body out of it. It remembers.
Yeah.
And I'd love to dive into that with you.
Yeah. I think as somebody who did a lot of cognitive behavior therapy for my own trauma, it's like, I get it. Like, I am good cognitively, logically. My conscious mind is like really skillful, like very skillful. And then you look at my heart rate variability and it's like, you're going to die. And okay. And so
Where's the disconnect?
this is where somatic therapies like acupuncture, like yoga, like singing, like humming, like cold water plunges, like all sorts of things that we can do are so good because these are the things that we need on a cellular level to say it doesn't matter what your brain thinks, like you have to chill your nervous system down, and it's not going to do that consciously. It has to be on a cellular level. So I love being able to do acupuncture because it's such a powerful way to reset the nervous system and bring it out of that locked into fight or flight mode. And it is one of those things that you have to experience it enough times and see, okay, there wasn't a tiger there. I didn't get hurt. I, that actually was nice. And it might actually not be nice right away because it's so cognitively unfamiliar. So you have this conscious brain that's, I'm good. And then you have your brain that's, no, you're not. And then you have okay, you want me to relax? I'm going to relax. And then it's just, I can't relax. I suck at it. I'm stressed. I'm stressed about my stress. And so that sort of way of doing it will not work versus doing things like we're going to move your body, we're going to put these acupuncture needles into the body, we're going to do EMDR with buzzing and eye movement and things like that. We're doing things that take out the like you're trying to relax and just somehow make the cells in your body start to lessen that charge and feel safe. And all of a sudden it's, oh, physically, my heart rate variability changes. And then, as you alluded to, all these things that if you're in chronic fight or flight, right? Your body doesn't care about getting sick if you're going to die right now. So your immune system's all wonky. You probably are going to bleed if you're in danger. So your clotting and your circulatory system is really like really changing. And that's where we get locked into high blood pressure and vascular changes when we have chronic stress things. And so your endocrine system doesn't want to digest food. If you're going to die, so it's going to go out to your muscles and your limbs, like you said. So all of these things can start to shift, and it has to be on a subconscious cellular level for it to work on true trauma. There's some people that are like, oh, I'm just stressed out about it. And then maybe you should go on some date nights and do some exercise and that might be enough. But when you have really lived trauma, like pregnancy loss often is, especially after trying to conceive for a while, when you have things like childhood adversity and high ACEs scores and childhood emotional neglect and things like that, where it lives in your body, it's really helpful to get in on this level.
And I wasn't actually told that. I knew that it was big for me. There was a moment that I'd made a phone call to mum and said I was going to die. And
Mm,
I legitimately thought that was going to happen because I'm like, no one can bleed this much and
when you were
survive.
bleeding. Yeah.
So I could only imagine what my mum would have been thinking on the other side receiving that call. And it wasn't until I saw a therapist that she told me I'd written everything down. I was always good at getting out of my head and writing. And I just wrote. I wrote all of the thoughts. I wrote my whole experience. I wrote everything that happened in detail. She read it, and I just spent the first session with her reading my notes. I didn't speak. I think I sat there and cried. And she's like, Shana, this is trauma. And I was like, okay, great. Now I have the name for the big feeling, the big experience, but now what do I do with that? How do I help
Right.
myself through that? Because again, it almost feels like it stops. You get told, even in the medical, as at the doctors, you've gone through a miscarriage. Okay, now what?
Mm-hmm.
I went to the therapist. I got told I was experiencing trauma. I'm like, okay, now what?
Right.
Now, how do I process that? How do I move through that? And you almost, they give you some tools, but it wasn't ever what I needed. I needed more awareness. I needed more tools. I needed more support.
Yeah.
And I think this is where women, the experience feels big to them, but they push through that. They're like, no,
Mm-hmm.
I have to fall pregnant again. I have to do this thing. And when you're pushing through, it's not actually supporting you, because if you're, like you just said, if everything is wonky, if your reproductive system is actually offline, you're not helping yourself by doing that. And I believe, I don't know for sure, but I feel like this is where women then experience multiple losses and it compounds the trauma.
Yeah. For sure see this data in like stillbirth and child loss and subsequent fertility struggles when there were none before. So that's a really clear
Mm,
example of where it's just like, why would we do that? That's so traumatic.
mm,
And miscarriage in a way, there's not just the get back to it, I want to fall pregnant again. There's the I can't miss this meeting and
mm.
zero cultural awareness of. I think somebody on one of your shows was talking about hosting a dinner party
Yeah.
while their tissue was passing and they were thinking about that being their potential baby in their future life and they just didn't think that they could step back and say I can't host this thing right now, and that's everywhere. And unless we talk about it, unless we challenge it, unless we see what's going on underneath, then we're adding to it. And like your story of feeling like you were dying, just the information, the expectations, the this is what's normal, this is not, this is a resource, if it doesn't feel right, would have made that feel so much less threatening. And it was traumatic to lose that much blood and to lose the pregnancy, but then it was compounded again by lack of information. Here's your brochure. I think you talked about the brochure. And
Yeah. It,
okay, what do I do?
yeah, now what? I think my
Yeah.
husband was Googling how long the bleeding was going to last. And yeah,
Yeah.
he found something that said 10 days. And that was in my mind. I said, I'm going to die. I will
Yeah.
die if this
Yeah.
lasts for 10 days. Again, it's the misinformation. And like you said,
Mhm.
it just compounds. So 1 in 4 pregnancies will result in miscarriage. 1 in 8 women will experience infertility. 1 in 100 women will experience recurrent miscarriage. And 1 in 160 births end in stillbirth. Have you been wanting to make a difference in the lives of women or men who have experienced pregnancy loss because you can see so many suffering in silence, but you just don't know how? Collectively, we can change how bereaved parents can access mental, physical, and emotional support after their experience. There is a lot of women with unhealed trauma, and there is a huge gap in the current support system when it comes to bereaved parents' recovery after loss. There are too many women and men suffering in silence. The Pregnancy Loss Practitioner Certification is a worldwide, one-of-a-kind program that gives you proven methods designed for healthcare professionals, medical staff, midwives, nurses, doulas, birth workers, coaches, and angel parents alike. The Pregnancy Loss Practitioner Certification is bridging that gap. It will give you a proven support structure to follow and education specific to pregnancy loss, created by a lost mum. It is creating more education specifically for loss so that you can enhance your service and become the point of difference. Or you can create the support that you so desperately needed in your healing after loss. This is the next level of growth and expansion you have been searching for. So does this sound like something that you have been searching for? Let's explore this more together. You can head to the episode show notes where you'll find the program application, or direct message me on Instagram and let's open up the conversation in how you can use this education. You have a gift, and I look forward to supporting you and witnessing you bring your gift to the world, healing and transforming women's lives. You don't expect to go through, which I went through was a lot of blood loss. I went through contractions. I was not
Yeah.
told about that. So I was told it would be about like a heavy period. And I'm like, cool, I have heavy periods.
Yeah.
I know what to expect. And that was not.
Can do. Right.
Yeah, I thought,
Right.
yeah, I could do that. And then I was questioning, maybe I don't have heavy periods. Maybe this is a heavy period. Maybe like I've not
Mm.
experienced a heavy period in
You were
my
almost like
life.
gaslit for your own lived experience and all your cycles before that.
Yeah.
That's a lot. That's a
Yeah.
lot.
So I was questioning everything. I was questioning myself. I was questioning what was happening. And then it wasn't like I had this feeling of this was huge. And then I felt like I was making it all up. Because as a kid,
Mm.
I was always told that I have a low pain threshold and that I would over exaggerate the pain because I was like screaming trying to get a splinter out. And my neighbors came thinking that my dad was trying to murder me because of the way like the scream that was coming out. He's no, they came over, he had a tweezer in his hand and he's like just trying to get a splinter out.
But maybe speaks to a kiddo with an amped up nervous system. And there's the generational trauma again and the different things
Yeah.
that live in us that are, there's a wild study, and I should just look it up because I cite it sometimes and I'm like, I'm just gonna estimate. But there's this thing where they have electrified the bottom of a cage for rats, and they have the rats in there and then they zap them as they're going through this maze at the same time that they put in the smell of cherry blossoms. Have you
Yes.
seen this?
I've read
and
that. Yeah.
and 5 or more generations later, just the smell of the cherry blossoms without the electric shock makes the babies skittish. And when you think about how we've treated emotional health and emotional needs historically, and then compounding different sorts of access to differing levels of privilege and care, and it's, gosh, even those of us that are living really charmed lives with very doting parents, we were talking a little bit about this before we started. You think you're going to have a kid and you're going to do the things that my kid is going to be emotionally intelligent, and I'm going to be an attachment parent, and I'm going to bond and do all these things and talk about feelings. And then they're like, oh, you're still really anxious. And that, that checks on this level.
Yes.
Here we,
And I think like we were talking before, and I said I think my mom is a ball of anxiety. My dad died when I was 19 from a heart attack, and so he had heart issues his whole life. I was his first open heart was when mum was pregnant with me, and the second was when I was about one, I think.
wow.
So there was a lot of trauma there that she would
Yeah.
have been carrying while she was pregnant with me. And when so she physically has never really had any health issues until just in the last couple of years has been diagnosed herself with heart issues. And she's had
Mm.
a couple of heart surgeries now. I can only tie it back to how her body has been trying to cope with the
Mm-hmm.
trauma, with the anxiety, with the her nervous system is always switched on
Yeah.
in a survival response to how then her heart is now trying to cope. And when we were talking before, watching my mum and how she has lived her life, then how I was having panic attacks as a child
Mhm.
through school. And I would wake up in a panic attack out of a sleep. And I'm like, what the hell was I dreaming about? Like,
Right.
to wake up
What's
out
in
in
there?
what's in there to wake up in a panic attack?
Yeah.
I had panic attacks into my 20s that I ended up having to be hospitalized for because I couldn't get
Mm,
myself out of them. And then to be aware of everything that I'm aware of now, but I didn't know any of about the trauma, about generational trauma when I was pregnant, obviously going through
mm,
miscarriage and then falling pregnant after my miscarriage. I didn't know about that. So obviously what's carried through for my mom and myself is now in my daughter, and she's had severe anxiety like ever since she was a toddler. And I was in my mind, I'm like, how is that possible? How can she be so anxious and so little? But then I
yeah.
realized that whole generational trauma. And then I started obviously doing my own deep dive into it and how important it is for us to choose our healing first
Mm,
so that we can provide, not to say that you're never going to provide the best chance for your child, the best upbringing for your child, but to
yeah.
try and mitigate them being born in a higher
Yeah.
nervous system state.
Yeah. And I think there's this meditation teacher that I love that says, conditions being what they are, how can it be anything other than what it is? I trust that every single pregnant person is doing the best they can based on their conditions in that moment. And as our conditions change, then we can make different choices and we can make things. So I think there's so much room for compassion, also not needing to be perfect. There's continuums of sensitivity, there's continuums of nervous system hypervigilance, and some of that is very variable from person to person. We know this from primate studies, right? We look at primate studies and we say, okay, if we stress out all these primates in the same way, some of them will keep having babies, some of them won't. Some of them will seem very agitated and some of them won't. So humans are primates. We have these different levels of arousal, different levels of sensitivity, and we're all doing our best. But I think when the awareness enters into it, it gives us this opportunity to look at these amazing new tools to talk to the body, not the mind, right? And then that reshapes our neural connections, that reshapes what's firing in our brain, what's cognitively familiar. And we can still disrupt it and we can change things now. We can hopefully, by doing this podcast, you're helping more people change it sooner and changing conditions a little bit sooner. But I feel the same way. I was like, no, I'm going to do XYZ when I have my kids, and they're not going to be anxious like I was. And I obsessive compulsive. And I was putting cough drops in every single pocket of every single thing, or I would have a panic attack when I was a kid. And then it's, oh, my kid can't have anything touching any light switches. And it's just so humbling, so humbling. And yet he's and both of my kiddos have different variations and we've all made progress, and it's yay, they get to do it sooner than I did, and have more of their life be supported in that way. So that's great
Yeah,
too.
it's beautiful to know. It's beautiful to say it in that way because also to have the awareness. Like my mom was amazing when I was having panic attacks, but she didn't know how to truly support me in that mentally, physically. She'd sit with me until I could move through it. But to have that awareness for ourselves now and know what's happening and be able to shift the patterns sooner for the kids.
Yeah.
And it's like we spoke about before, it's never that is done and dusted. Oh, I've had my baby now has anxiety. It's too late. That's
Right.
not the case at all. And
Yeah.
at any moment through your healing journey, whether it's just loss, after infertility, after having your pregnancy after loss, or after a traumatic experience, there is just that choice for you to go, okay, yes, now I choose myself. Now I choose my
Mm-hmm.
healing. At any point, it's never too late. But just like you said, the awareness is so vital because now we can make those changes sooner in us, in our children too. We can support them, we can understand why they're acting out the way that they are, and potentially, instead of being told, like our parents may have said, don't overreact or
You're
don't be,
too emotional.
yeah, don't be so emotional. But clearly there was something happening internally,
Yeah.
like you were dealing with something.
Yeah.
So now you can have that awareness for your child and go, okay, it's not, she's not having a tantrum for no reason. There's something there, and trying
Yeah.
to understand what's happening for them.
Yeah.
And I think that's very powerful.
There's a great book for neurodivergent kiddos that I read that talks about the prefrontal cortex like the owl and the midbrain as a watchdog or a possum. It's called Raising Kids with Big Baffling Behaviors. But I think it's great for adults with trauma in their nervous system and adults with neurodivergence too, which is built in disconnect neurologically from the world, which is very neurologically unsettling. And I think what we're talking about, like what we started with, is like that idea of I can do all this therapy, I can understand, I can be a high functioning adult, I can make these good choices. And that's owl. That's like the owl being like, yes, I am an adult. And then there's this little like dog that's like, but I'm Barb. It's just like, I heard something. And so to not try to do owl stuff with the dog and not try to do dog stuff with an owl, these are just very distinct ways to work on different things. And we need it all, and it's all useful in different ways, but especially when you have a dog that's been primed through these prior experiences and traumas to be extra wound up. It's just like the most alert little dog. Then I was telling this to a patient the other day, and she's, I'm more of a cat person. And I was like, all right, what kind of cat? And I drew her a little cat on the back of a little mantra card that said, it's like this now. And it had a little cat going, this is hard. You're doing great. And she sent me a picture of it on her little IVF station. So if we could just be like, ugh, my owl gets this, but my little inner cat or dog is freaking out right now, then we can be nice about it too, instead of being like, why are you barking again? Or why are you meowing at me?
Yeah. And then when we're saying why you're doing that, we're trying to then dismiss it and push it away because
Yeah.
we don't want to feel that. But then when you're being given permission to go, okay, this is actually what's happening and this is allowed, they're allowed
Yeah.
to they're
Yeah.
allowed to bark, they're allowed to meow, they're allowed to speak.
Yeah. They're barking for a reason. It might
It's
not be something in that environment, but historically there's something there.
yeah, yeah. And when we can start to understand that our body, when we've gone through trauma, our body is in a heightened state of looking for threats like all the time. And you cognitively, mentally can't figure that out. Your body is just like this own little radar system, and it's going out and it's scanning the environment constantly.
Yeah.
So it's going to send off an alarm before you can mentally figure out what's actually happening.
It's
And
four times a second it's doing that.
yeah,
That's the science. It's,
so it's a lot, it's constant. And
yeah.
when we can start to go, oh, okay, this is what's happening. And like you said, and it can be just taking a breath in that
Mhm.
moment, taking a pause and going, okay, I understand. I can, you may not understand, but I can bring awareness to what's happening to me right
Mhm.
now and support yourself in that so that it doesn't keep happening. You can slowly start to bring that awareness, slowly start to bring your awareness to what your body is actually alerting you to. Or it could just be a
Exactly.
feeling or a thought or something.
Yeah. Yeah. A little acupressure, a little 4-7-8 breath, a little humming, a little gargling, a little face splash of water. There's so many DIY layers that are just like, okay, we're just going to recognize and honor it. We don't have to logically do anything with it.
Yeah. And that's the thing too. Like I think when you talk about somatic practices, people are like, I have to do this big, elaborate meditation, or I have to do this
Right.
thing. And you're just like, no, there's simple little things in those moments that you can do to help your body move through what's happening, to help your body discharge the emotion, discharge the energy that's happening. And it doesn't have to be obvious to anyone else. Like you,
Right. It can be totally like feel your feet in your shoes and two things you can hear right now. And that's just so present that the dog is okay. That's okay. We're just feeling our feet.
yeah. Or like a
Cool.
dog when dogs naturally shake. So they'll to
Mm-hmm.
dispel energy. So they'll naturally shake their body. So it could be just in that moment, just doing a little jiggle with your arms and your legs just to
Yeah. Yep.
Yet I do that all the time. I'm
Yeah.
like, because there's a lot of anxious energy that's always running through my body. Just understanding what that is for you and what little resources and tools that you can put into your day to help you move through those moments instead of dismissing them and pushing them aside, because dismissing them and pushing them aside is not going to actually support you. It's just pushing it back in, and all that's
It's
going
gonna,
to do
yeah.
is make it bigger.
Yep. It's just yelling at the dog for being a dog.
Yes,
and
I love it.
and I think when we think about chronic stress, right, it's easy to be like, but it's not going to go away because I'm still trying to have a baby, or I'm in this loss, and we don't have to get rid of it. We just have to put these little pauses into it. So I tell my patients, just think about this as a big long equation, like a big long mathematical thing. And if it's heightened hypervigilance and threat and overwhelm and confusion, and then 3 deep breaths. And you just pepper it in a little bit, and maybe it's a little more intentional 1 hour of a trauma informed therapy, or getting an acupuncture session where we really do reset the nervous system fully and then walk out the door with the stress cycle totally reset for that moment, or going and exercising and resetting it in a bigger way, or having an orgasm and having a reset in a bigger way. There's lots of ways to do this. And so if we do enough of those little moments in ways that actually feel good in real time, right? So there's the back to that theme of it can't be done in a way that feels threatening and feels overwhelming and ignores what you actually need and want, because then it's just going to be part of the stress cycle instead of disruption of the stress cycle. So a lot of things can look the same. It's what it feels like. What does it do inside your nervous system? And if we stop and we ask, okay, where is my actual fertility quest activating this in ways that it doesn't need to? Where is it activating this in ways that are necessary means to an end? So I need to offset those, not worry about getting rid of them. Where is it just doing it subconsciously for stuff that I don't see, but that's living in me still? And how do I keep working on that? All of a sudden, we have this thing that feels really empowered and really doable instead of just really overwhelmed and frazzled and PTSD. That's a
Yes,
word.
exactly. And with PTSD, it's not a disorder, it's a readaptation. Like it's
Mm.
not, it's just a way that your body has now adapted to the new normal of where you are. But that, oh, I just lost what I was going to say then.
We do that all the time.
I know. I had it was like you were talking and I was like, yes. And then my brain went off in a tangent.
The equation part or the disruptions, maybe.
It was yeah. Oh,
It's
how
okay.
frustrating. Anyway, but it is important. And I think, like you said, it's a very empowering place to be. Oh, that's what I was going to say. It's not
Mm.
like you're having things coming at you all of the time,
Mm-hmm.
feeling overwhelmed, feeling weighed down, and feeling like you can't escape. Everything is just being shot at you. When you take these breaks, like when you can pause, when you can put a disruption in the pattern, when you can create that space for yourself to understand what's happening or just to put in a practice or whatever, it stops the feeling of everything feeling like you've got a million arrows shot at you and you can't move and you can't do anything. It does then shift the table where
Yeah,
you are now choosing to do that, and you're choosing now that gives you more power in responding to what's happening and not just reacting to what's happening.
I love that. And that's such a great stress tolerance kind of cultivation skill to be like, okay, I don't actually choose this bigger thing. What can I choose within it? That makes something much more tolerable. And sometimes it is entirely within us. It's not an external looking thing. It's like, I choose to reframe this as my opportunity to combat generational trauma, or my opportunity to learn about my nervous system and get it more regulated so that I don't have to feel anxious all the time, or my opportunity to be more evidence based and empowered in this journey towards trying to build my family. And all of a sudden, there's this purpose, there's this choice, and it's much more tolerable than what you were describing with it's happening to me.
Yeah. And it's a very overwhelming place to be when you just feel like
Mm-hmm.
you're being buried. You've got all
Yeah.
of this stuff just coming at you, and you're like, oh, I can't move, I can't breathe, I can't think. And you just want everything to go away.
Yeah.
but it's not going to happen. Nothing is going to stop. The world keeps going. We keep living our life. So how do we then choose to empower ourselves? And it is
Hmm.
asking the questions. Like it's having more body awareness, having more, what choices can I make here? What would actually benefit me? What thought process
Yeah.
would benefit me?
Yeah.
When you're feeling emotional, how do I process this emotion rather than trying to just go, okay, everything's too big. I'm just going to put it in, try and sweep it under the rug and not deal with it. But then you've just got this mountain under the rug that you keep tripping over. So
Yeah.
it doesn't, it's not going to support you. But small, simple little practices, like you said, just scattered throughout your day when you're having the moments where the dog is barking at you and you're not then turning around and just yelling back at the dog. Like it's then going, okay, what's happening here? What happened? What led up to this point? What was I
Yeah.
doing? Who did I speak to? Where have I been? And trying to, like you said before, connect the dots for yourself too, because that can be
Yeah.
very empowering to understand where all of this stuff is coming from.
I love that point that you just made about stopping and thinking about what was going on. That 4 times a second we're scanning for safety. That the science on that says we're scanning inside. So we're actually like, what is my heart rate already? If your heart rate is elevated, it's gonna, I must be in danger. So when you do things that manage that or change that can actually send your body like trick it. So there's acupuncture points that can change the heart rate and oh, my heart rate is calmer now. I take propranolol, big fan. It slows down my heart rate. It was the final, it's the tiniest dose. My doctor's, this is not even a clinically like relevant dose. And yet I swear it just takes that tiny little bit of buzz that I could not get with EMDR, could not get with somatic stuff. And all of a sudden I was like, oh, now I can poop and I don't have this buzz of anxiety that was just like still a little bit there. So there's all different tools, there's all different ways to do this, but we're scanning inside. So when we change our body inside, we can do that. We're scanning outside. So does this environment feel calming or does it feel aggravating? And then we're scanning in between. So that connections, the feeling supported, the being around people that love us and people that care and people that are giving us education and empowering us, that's another way that we're scanning for felt safety. Right there, you could set a timer for 10 minutes and think about how, make a list of all the ways you could make your inside, outside, and in betweens feel a little bit more safe and start cultivating those. And that would be a great way to work on this nervous system stuff.
Yeah, that's beautiful. It's again taking that control again of what's happening where you feel in a moment that it just feels so uncertain and so out of control. What these little practices can do is bring that sense of control back because you can't control what's happening outside of you. You can control the places that you put yourself in to some degree. You can control the people that you surround yourself with to some degree, but not all the triggers, not all of the experiences are going to be able to be just completely gone. So
Right.
how can you bring that sense of safety into your body and figure out then practices, tools that you can do to do that? Like I said, I could talk to you forever, and I really do
This is
want to.
great.
I'm honoring your time. Is there anything else that you would love to leave the listeners with today?
With this, the title of your podcast, which I love, I think something that I wish people knew before they had losses is that there's nothing we do that causes a viable pregnancy to there's complicated biomedical conditions and things that are going on, especially in the case of recurrent losses. But I think the body is picky about getting pregnant because it only wants to commit to the healthiest, most doable, amazing pregnancy. So I tell my patients all the time, fertility is one thing, and then pregnancy is the total opposite. Once your body does it, and again, there are reasons why a pregnancy would stop, but it's not because you walked the dog or because you didn't put your feet up and you did that event for work or you accidentally had the unpasteurized cheese. I think that's such a harmful thing that people carry with them. And this is another good example of logically you can understand, but I think it's so important for every single person who's had this kind of experience to hear it over and over because there's some part of your nervous system that's, but maybe if I would have slept better, or maybe if I wouldn't have had that cold. And I just, everything that the science says, everything that I've seen is that the body is pickier about getting pregnant because once it's pregnant, it literally will kill you to keep a pregnancy going in most cases. And so there's something else going on, something bigger, something beyond our control, something more complicated, and that's still heartbreaking, but that is not a personal choice or failure or something that you could change. So I just want to leave everybody knowing that and hearing that from one more person.
Thank you so much. And it is very reassuring. It can feel hollow sometimes because then you're like, oh, I hear it, but it's not, but I don't feel it. But if you, like you said, if you have enough people telling you that it's not your fault, that you didn't do anything intentionally to hurt that pregnancy and hurt that baby and have it not work, because more often than not, this is something that you really deeply wanted for yourself. You didn't do anything to cause it. It is something that is reassuring to hear over and over, whether or not it lands straight away or not. But
And you didn't do
hopefully,
anything subconsciously either. It's more complicated than that. And so this idea that if you didn't believe or you weren't excited enough or any of that either, it's just,
or you thought bad thoughts, or you
yeah,
were upset and or you were grieving something else, that you were pulling all of that in, because I think a lot of
yeah,
people think then they thought bad thoughts, so they made it happen. Like
yeah.
you're
I
allowed
think
to
that's magical thinking. That's just not how it works.
you're allowed to think bad thoughts, you're allowed to have emotions, you're allowed to do all of that.
Yeah,
That's just human experience. That is basically what we're meant to do as a human,
yeah.
is go through these motions. So yeah, it's not that you've ever had done anything or thought anything or felt anything intentionally.
Including your trauma and where that lives. It's just, it's way more complicated than that. And we're not doing coma pregnancies. So we're going to feel all the feels and have the histories and the complexities and all of that. And so I just encourage people to keep on knowing that as much as you can in your heart and keep on working on the big picture stuff, not because it makes or breaks pregnancies, but because it makes or breaks fertility and your body's willingness and felt safety to go. And then once that happens, there's total other things to think about and talk about, but it's not you do this or you don't do that.
Yeah, no, beautifully said. Thank you so much. Thank you for everything that you've spoken about today. I feel like we've only just touched the surface of it. So many different points that we were able to cover.
It's big. It's so big. And it's so exciting to be like, this is the future of good medicine, good fertility care, good pregnancy care. So thank you for the opportunity and for the work that you're doing. I'm so grateful.
Me too. So, would you like to share where people can find you, reach out to you, see what you do?
Yep. It's all on lifehealinglife.com. That sounds redundant, but it's life healing life as opposed to doctor fixing patient, life healing life. And there's a tab at the top for online education, and you can click on that, and it brings you to my fertility freebies, my emotional health resources, my online courses. I've got a YouTube channel, a blog, loads and loads of free content. I love teaching. I love empowering people. It's just my favorite thing. And needles are awesome too, but this is, I don't know. If I had to pick one, it would be a real hard thing to pick. I hope people will head over there and check out all the resources.
Yeah, no, and I think that must be the connection that I have with you, because I love teaching too, and I love teaching the
Mhm.
things that are outside the box. So
Yeah.
I love that you're in this space and you are able to help women who are obviously going through the fertility journey, through pregnancy loss, but also other traumas and life experiences. And I just want to thank you for using your story to bring all of that out of you to be able to share with others.
Thank you.
You're so welcome. Thank you again, Nicole, for being a part of the podcast.
I'm sure we'll be in touch.
Absolutely. Thank you to all that have listened in. If this episode was valuable to you, I invite you to leave a review on Apple Podcasts, and I look forward to supporting you on the next episode. Thank you for listening in with me today. I hope you found this episode helpful. If you did, I would absolutely love to hear from you. Take a screenshot of this episode, share it to social media, and tag me at Institute of Healing_PL. I love seeing what is resonating with you right now. If you want to chat further, I invite you to connect with me through Instagram. Head over and follow my Instagram account, send me a DM, and let's open the communication. If you want to know more about how you can be the support for others, head to the show notes and fill out the application form for the Pregnancy Loss Practitioner certification. I want to also note here that what I share within the episodes is not medical advice. If you need further support, please consult your doctor. Thank you again. Much love to you. Be gentle with yourself, and I look forward to supporting you on the next episode.